Okay, well, good morning, everyone. I've got 9:02 on October 16th, 2023. Thank you guys very much for taking time to be here this morning. We have a special guest that will be joining us in just a few minutes, Dr. Brooks. He's going to tell you about his practice, Horizon Primary Care. But I do have some stuff that I want to go through this morning just to make sure that we are all on the same page as we're cruising through AEP, because congratulations, we made it. Yesterday was the first day. So we should expect lots and lots of applications coming in from you guys this week, and we're going to talk about shop and all that and all how that's working as we're cruising through AEP 2024. So before I go too deep, we are here to improve the lives of our community with affordable healthcare. So again, thank you for being on this call, and I do understand that you guys are going to be out and about. Meeting with clients on phone calls. And so if you miss one of these calls on Monday mornings, just remember that you can go ahead and jump over to our YouTube channel and we will keep you up to date. There we go. I got you muted there. We'll keep you up to date on our YouTube channel to ensure that everything is kosher as you're going through AEP, because we always get some surprises here and there. So with that, we got to keep one foot in the classroom and the other one in the field. Just a reminder, if you haven't yet completed all of your certifications, you still have time. Remember, the ultimate deadline is to ensure that your RTS for each of your carriers by November 30th. After that, you will be taken off of their selling permissions, and then you'll have to reapply through your contract. Okay, so don't let that expire. Even if you did a couple of sales, make sure that you're going to get in there and get your recertification done, because it's worth the 2 sales or 3 sales that you did. Just do the calculation in your head, because it's only about an hour of certification. So I'm sure you'll make it worth it. So with that, we've got some trainings, not a lot going on. Again, we're in AEP, so we shouldn't see a lot of training sessions out there, but just in case, United Healthcare is still doing their virtual office hours. That's today at 4 o'clock. Devoted's doing their open training session tomorrow at 11 o'clock. So if you still need a little bit of TLC with Devoted, they're going to be open. That's a hot plan this year, 11 o'clock tomorrow. Our Al Clancy, our very own Al Clancy, is going to be available throughout AEP for a virtual coffee and chat session. So if you have any questions, concerns, or anything that you might need a little bit of help on, Al Clancy will be helping you there from 9:30 to 10:30 every Wednesday. And it could be anything from, LIS to Medicaid to, we're going to talk about COLA this morning. So if you're confused about that, that's another great topic that maybe you can talk to Al about. So that's on Wednesday at 9:30. Also Wednesday, we've got 10 o'clock. We've got Humana doing veteran training. Again, a great training session if you're wanting to know more about veterans and how the Medicare Advantage plans and supplements work in conjunction with that. And just as a reminder, Humana actually administers the TRICARE program for the federal military. So they're very in tune with what's going on with the veterans. So check that out. And then Cigna's doing their virtual office sessions at 11. And then last training for the week is Tom Ryan is going to be hosting our HPM shop. We're going to talk a little bit about that this morning. HPM shop is going to, again, we've gone through a revamp for 2024. And if you're confused, not really sure what's going on with that, please make sure that you pop into one of those sessions every Friday at 9 o'clock. So that's the training for the week. Remember to keep one foot in the classroom and the other one in the field at all times, guys. And that is how we're doing it, even in AEP. So if you can find time to ensure that you are keeping up to date with what's going on, you're going to have a very, very successful year. So with that, I am going to bounce over to some news that we had. COLA is the cost of living adjustment that is made usually by the federal government through Social Security. And this year they have announced an increase to those that are receiving Social Security by 3.2%. Okay, so what that means is your members that are on Social Security will get an increase in their Social Security check by 3.2%. Okay, now they're raising the cost of living adjustment, which usually means that they're raising the Medicare Part B premium. And so that has been announced as well. And so the new Medicare Part B premium is going to be $174.20, I believe it is. Let me pull that up. 174.70 is the new Part B premium for 2024. And we were looking at some of these give back plans that were giving back the 164.90. So it looks like they're going to be taking about $10 out for everybody's check, even on that plan as well. Okay, so you've got you've got the cost of living adjustment going up, but you also have the Part B premium going up, so it might offset it a bit for some people. But just based on the numbers, it does look like most seniors are going to end up ahead versus behind just on that cost of living adjustment. 3.2 isn't too bad. It's a nice little adjustment based on inflation. So if you have any questions on that, remember that we're here to help you on that. One caveat is if you have members that are kind of teetering on LIS status, they just made it in, or you have people that, you know, are QI1 that just made it into the Medicaid program, this cost of living adjustment could bump them out of the Medicaid program or the LIS program. So keep that in mind. So think through your book of business and really just try to figure out, you know, is that going to mess with any of my members? Especially those decent members. If they get disenrolled, they'll have an SCP, but you definitely don't want any disruption of service. So that's what could happen there. All right, so I updated the Medicare Advantage sales process checklist, and this checklist lives on our Gold Key that you all should have access to. Remember, it's joinhpm.com/Gold Key. And you can just hit Control P to search for the sales process checklist here. And this has the disclaimers. It has links to a script on what you need to be writing for. It's got the recording sessions here on how to do a recording. We've got all the disclaimers. We've got links to Spark. We've got links to Shop. All the step-by-step guides in video and PDF for most of these options as you're going through it. So quick overview, it goes through the disclaimers that you need to read to the members if you're doing a telephonic enrollment. It's got the onboarding for the scope and for your members in the actual CRM system. It walks you through the needs analysis. It walks you through the preferences. It helps you through the enrollment process, and then, of course, the retention at the back side of it. So I've got links already set up for everything, so everyone has the ability to click PDFs, videos, and anything else that might be necessary for you to complete your application. So I've gotten some feedback from some agents, and they feel like this is very, very helpful to walk through that. So again, that's in the Gold Key, but I will give you the direct link right now in the chat in case you want to use that. And this will help you in your journey as you're going through and helping people with your Medicare Advantage plan. So check that out. Make sure that that's working for you. We also received a notice from Florida Blue that they are now on Connecture for the VBE or HRA form that we've been talking about. Last year, you had to go through their enrollment platform in order to complete the HRA and get the HRA compensation for that, the admin fee. But they have recently connected with Shop through Connecture, who's the same company that built our enrollment platform. So HPM Shop now has Florida Blue HRA VBE forms on the enrollment platform. Okay, so you don't have to bounce out. You don't have to do that separately. You don't have to do the application on Florida Blue to get compensated for your VBE. Okay, so here on Connecture, you have it's $175 to get that HRA done. That's paid to you. They cannot charge it back because it's considered an admin fee. Okay, so once you get your member enrolled, you can complete that HRA form at the backside of the enrollment process, and then you'll get that paid, that $175 paid to you for Connecture. In fact, it's more on Shop, doing it on Shop, than it is if you use their own enrollment tool. It looks like they're only paying $150, or if you can do a schedule back, which is only $50. So it looks like it's a little bit more you get paid a little bit more for doing it right in Shop. So you should have gotten an email if you're RTS with Florida Blue. You should be able to see this nice email where it shows you the different regions, who your contact information is, all the vendors and helpful numbers. We have this saved on the Gold Key as well. So John's noting that the HRA breakdown is going to be coming soon. So he's building that out for the Gold Key just so you guys have some eyes on what's going on between all these HRAs and the compensation and all that good stuff. So appreciate that, John. Thank you for doing that. Jumping over to shop here, as a reminder, for HPM shop, we are seeing that there are some errors happening in the enrollment platform. We have seen that. So as you spot them, please take a screenshot and send an email to support@askhpm.com, and we'll get right on it. But it's really important that you be as detailed as possible on what's going on with that error. So if you can take a screenshot and email it over to us, we'll get right on it and escalate it over to Connecture so we can get that resolved. We realize that we're not going to be able to catch every error, and they're not going to be fixed right away. So your patience is appreciated, but we will go ahead and load it up and get that going as well. Okay. So we've got the shop errors are still out there, just so check that out. And then last reminder, we're getting lots and lots of notifications. Hey, I can't see my Humana. Hey, I can't see my Devoted. Hey, I can't see my WellCare. It's probably because you have not yet told us your RTS. Now, as a reminder, we talked about this over the summertime. The companies don't always tell us that you're ready to sell. So if you're missing a carrier, please go through your carriers on Shop. And again, you log into Shop, you go to Account Overview, and you can scroll down to the bottom, and it will show you that on how to get. Let me just go through and show you guys really quickly again how to get in there. I think this is it here. So remember, you've got to get in there and you've got to check your selling permissions. If you haven't checked your selling permissions, you're going to be surprised when you can't see the plans that you want. So again, you're going to go up to your name, you're going to click Account Overview there, and then scroll on down, and you'll be able to see all the selling permissions for all the plans that you are currently RTS for in the software. If you're missing one and you have ready to sell notification, you got an email or you got a screenshot from the carrier, please send it over to support@askhpm.com, and we will look at that and cross-check it against the carriers. Our goal is to protect you from any compliance issues, so that's why we just don't load all the carriers all at one time. We need to make sure that you're ready to sell. Otherwise, you'll write an application and you're not ready to sell, and you will go to Medicare jail. No, just kidding. But you will get in trouble, and we don't want to deal with that. Okay. All right. So I'm getting I see in the chat 5-star plans. Yes, there are 5-star plans from what we've heard in Florida. We've got for 2024, 1/1 effective. We're seeing Devoted. We're seeing Humana. We're seeing Simply Healthcare as the plans that are showing as 5-star, and also Optimum I'm also seeing as well. So the best way to check 5-star plans, the star ratings are available on Medicare.gov. You should also start to see those on Shop today as well, but you can check it out. You can click Find Plans here on Medicare.gov, and you can go through all the star ratings. I'm not going to have time to do that today, but you just type in the zip code, and it will pull up the plans, and you will be able to see all of the star ratings available for 2024. So keep that in mind as you're going through that. And yeah, happy selling for AEP. So with that, I'd like to invite our special guest, Mr. Mark Brooks, my old buddy here, has joined us from Horizon Primary Care. And he's going to talk to you a little bit about his practice, a little bit about himself, and why you should recommend your clients to go see Dr. Brooks. So, Dr. Brooks, are you with us?
Yeah, can you hear me?
Yeah, we got you.
Great. Yeah, thanks for having me on this morning, Justin.
Yeah, my pleasure.
A little bit briefly about myself. I've been here on this side of the west side of Orlando for about 30 years. Did my residency at Orlando Health. Did my medical training at University of Miami and my bachelor's at University of Florida. We are located in the medical office building at Health Central Hospital. So it's a great location for us and our patients, and in the sense that we have a lot of services and specialists should they need those services, we have them in close proximity. But a little bit about how we operate here. We've been doing this for a long time. We've been in the Medicare Advantage business for probably somewhere between 10 and 15 years. I don't know exactly the exact amount of time, but we've been doing it for a while. We want to make sure that as agents, that we're going to take care of your patients. Our front office staff is well trained to prioritize, and they're actually incentivized that when a patient calls, when a Medicare Advantage patient calls, to have them make an appointment with one of our physicians within 2 weeks of that call. We've got, in addition to myself, Dr. Ian Figueroa and Dr. Antonio Velarde. And so we will get those Advantage patients in to see for a patient visit within 2 weeks. We can certainly give you a contact if you want to make an appointment while you're seeing the patient. If you want to call, we can do that too. We can give you a direct line to do that. In addition to that, we put a lot of resources into making sure that those patients are happy and retention of those patients. We offer same-day appointments. So in addition to the 3 physicians here, we have 4 PAs and NPs. And one of the big reasons we have them with us is so that we have the open slots available for urgent type of calls. We obviously would rather have them come see us than go to the urgent care or ER for that matter. So we pour a lot of resources into making sure that those patients are prioritized, as well as every other patient, but especially those. We know how important it is to you as agents to make sure that those patients are happy. Any other areas of topics that agents may want to know, Justin?
Yeah, well, I'll say my 2 cents.
Yeah.
I have been working with Dr. Brooks for a long time, and I have sent quite a few patients to his practice. And I am proud to say I have not had one patient call me and say, I'm not happy here and I need to change. So that is, you're batting 1,000, at least, at least in my experience. And so, yeah, he's talking right about the retention, because the main goal in working with a provider group is making sure that when you put a patient there, that they're going to stay there and they're happy. The medical is number one, the care is number one, but also, how he treats the patients and everyone in the office is also amazing. So, so one of the things that I want to make sure of is that when you put a patient with Horizon, that you can rest assured that they're going to do everything in their power to make them happy and to retain your membership. And I know Nick has been working with you, and so Nick's got eyes on our book of business as well, to make sure that if you guys have any issues at all, that we can escalate it to Dr. Brooks, so he knows what's going on in the practice there.
Yeah, Nick does have the direct line contact. Should you want or need to work a patient in that day, when you're sitting in front of the client or the patient, we can do that for you.
Awesome. Now, you obviously, we're going into another battle here with 2024 AEP, and I'm sure you're looking for some growth too. Is there any carriers at Horizon that you need growth, or you're focused on kind of getting that panel a little bit healthier, I guess, is as far as numbers are concerned?
Specifically, we're credentialed with, and we take Humana, Care Plus, WellCare, Freedom, Blue Cross Blue Shield, United. We're looking at a couple of MSOs are wanting us to upload Devoted. I know that Devoted is a big one this year. We're looking at that, but we're not yet on Devoted. So, but any of those from our perspective is fine. We just want to we want what is best for the patient from the standpoint of the economics and the benefits of whichever plan works for them. From our point of view, it doesn't really matter which one that they sign up with. We'll treat them all the same.
Awesome, that helps. And it's exciting because out of the ones you just mentioned, you actually have two five-star plans that you're going to be accepting next year, which means that we'll be able to continue to grow beyond open enrollment, specifically with Humana and Optimum, because I'm assuming you have Freedom and Optimum. Is that right?
Yes, we do.
Okay, great. So Optimum's 5-star as well. So both of those products, you can continue sending patients over to Dr. Brooks in January, February, March, April, for those particular products. So again, if you're not sure which ones are 5-star, you can go out today and start messing around with the Medicare.gov website, and you could see all the 5-star plans, and that way you're kind of familiar with what's going on there. Yeah, and one thing that we're always curious about is the chronic condition plans too, because we've talked about those chronic condition plans in the past. Diabetes, chronic heart disease. Is there anything that you'd like agents to know about those patients when they're choosing a plan or shopping for a plan specifically for care or benefits or anything like that?
Yeah, that's a good question. I I think that the agents are probably well trained and educated to make those type of decisions about what plan is going to work best for the patient. But diabetes and heart failure and COPD, of course, those are very common diagnoses that we encounter. We can take on and care for relatively healthy patients, and of course, it goes without saying we try to keep them healthy. We also see some of the sickest patients. As far as the benefits, it is very important to place, if a patient has a lot of comorbidities. It is very important to make sure they have a plan that they're going to be able to retain if they see a lot of specialists, that the specialists are going to remain on the panels. I find though that that's a little bit easier now than it was even just several years ago. My understanding is the Medicare Advantage market in Central Florida is 55-60% market share. And so a lot of the specialists now do take a majority of the Medicare Advantage plans, but that's probably of prime importance to a new patient who has a lot of medical comorbidities, that they're going to be able to continue to see their specialists. I saw a question, which county are we in? We're in Orange County. We're in the west side of Orange County, which is our address is 10,000 West Colonial Drive, which is again it's in the medical office building in Health Central Hospital. So we see a lot of patients from Apopka, from Winter Garden, from Ocoee, from Windermere, from Pine Hills, even from Claremont, and it goes out from there too.
Yeah, I know. I think I have some patients that might drive from Kissimmee to see you, if I remember
Yeah.
correctly. So, I mean, that's a 35-minute ride to see your doctor. And, that just goes to show you that, they're doing a great job there, and he's easy to work with. Going back to that question about specialists, how would you describe your, I guess, philosophy on referrals? Because we see a lot of patients that get really frustrated with the referral process, and sometimes it's not on the carrier level. Sometimes we discover that it's actually on either the primary care level or maybe a specialist. The way that they do their standard operating procedures, but that's really important because some patients do the shopping because they just haven't been able to get into the specialist because somebody's blocking them from getting in there with
Yeah.
this referral process. So can you talk a little bit about that and maybe educate some of the agents on, how you approach it and how patients should be using that?
Yeah. That's a really great question, and that's maybe one of the biggest sources of discontent
Mm.
among patients at times. Being able to access specialists, and there are several issues when it comes to specialist access. One of the most important is Florida is getting very crowded, overpopulated, and just for any type of patient, no matter what the insurance, a lot of times specialists can be 3 or 4 months wait time, even when you don't need a referral. So what I do is almost on every visit, I'm going to briefly review with the patients what specialists they see. There's two types of patients. If I can kind of divide the two types. So one
Mhm.
type of patient want to see all this, a lot of specialists, and of course, most of the time they need to see the specialists, and we evaluate that need and we make sure that they get in to see those specialists. The other type of patient doesn't want to see doctors all the time. They when we suggest that perhaps we can take care of something in house for them, they're actually happy to hear
Mm.
that. Now, we don't suggest that unless we are perfectly capable of taking care of that in house. An example would be somebody with thyroid disorder or well controlled diabetes, and we can, instead of them seeing an endocrinologist, a lot of times patients will feel that they're spending half their life going to doctors, and when I suggest that we can take care of things in house, they're actually happy. Now, you have to gauge their reaction. If they say, no, I'd rather see the specialist, then we're not going to push back on that. We say, yeah, that's no problem with that. Also, I've been here in this side of town for a long time. If a patient needs an urgent specialist appointment, I can get on the call the specialist cell phone and get them in sooner. If they need a urologist appointment and they call the office and it's 4 months, we can call. If it's an urgent issue, we can get them in within a week or two. As far as the referral process, we have two full-time referral coordinators that have been with us for a long time, many years, and we make sure that we get those referrals processed quickly, because that is probably one of the top 5 areas of discontent with patients, is the time it takes to get referrals processed, and we are well aware of that. And So we make sure that that happens in a timely manner.
Yeah, that's exactly what patients are looking for is a doctor that's willing to work with them on the referral process. And like I said before, it's not just the carriers, it's the providers that are saying, hey, and we've seen provider groups that have been trying to control the entire process and not refer out to specialists, and that's when you really see that. So it's refreshing to hear a doctor that says, hey, we'll refer out, but if we can't do it, we'll give them the option to get it done in house, and that's really nice to hear. um, Dr. Brooks, thank you very much for your time today. I know you're very busy. Do you happen to have that phone number agents can use to set up an appointment? Do you happen to have that handy?
Let me do this.
Mhm.
Yeah, give me a moment. I can get you the phone number. I was
Sure.
going to give you.
And yeah, and while you're waiting, I'm going to post in the website in the chat here. If you need more information about Dr. Brooks and his team, I just put the link in the chat. It's horizonhealthmd.com, and you can actually request an appointment right there on the website. It looks like too. So, in case
Yeah,
you want to do it
yeah.
that way.
So
Perfect.
if you're with a patient and sit in front of a patient, or and you want to assist with confirming an appointment or making an appointment, the phone number is 321-695-4643. 4428. And that is our office administrator, Jamie Martinez. And simply just place that call. She's just identify yourself, what you're doing, and she will get back to you or take care of it right then.
Outstanding. And that's really great that we have a phone number that we can call when we're setting that first appointment, because we like to make sure that we hand off with white glove service. So we appreciate that.
Great. Thank
Awesome.
you, Justin. Thanks for having me on today.
Oh, my pleasure. Thank you, Dr. Brooks. All right, everybody. So that's it for this week. Again, if you are going to be busy throughout AEP, just remember that we are recording these calls, and we will have more special guests just like Dr. Brooks here to keep us up to date and educate us on the best practices to take care of those patients out there. So with that, I wish everyone a happy first week of AEP. We'll be back here again next Monday, same time, same channel. Hope you have a fantastic week. Take care.